Hello and welcome to Hi-Fi Health News. I'm Erika Grotto. The nomination of Robert F. Kennedy Jr. as Secretary to the Department of Health and Human Services has been the subject of a lot of discussion over the last few months, including here at Hi-Fi Health News. Now that Kennedy is on the cusp of confirmation in the Senate, we thought we'd take a few minutes to discuss how he plans to approach the job. Joining me now is Nick Hutt, a senior editor at the Healthcare Financial Management Association. Nick, you listened in on the 2 days of hearings where Kennedy faced some tough questions about his views on key issues in healthcare.
It is important to me to understand whether you believe that taking Medicaid away from 60,000 people in New Hampshire would make Medicaid better. And would it make New Hampshire healthy again?
Let's first lay the groundwork with some basics. Exactly what will Kennedy oversee as the head of this department?
Basically, the nation's entire health and healthcare apparatus, at least at the federal level. Obviously, there's state governments and municipal governments that have their own health departments. But some of the agencies within HHS and the heads of those agencies would report to Kennedy, include the CDC, the Food and Drug Administration, Medicare and Medicaid, which are both within an agency called the Centers for Medicare and Medicaid Services, the National Institutes of Health, which is the primary federal research agency for health and healthcare.
Kennedy has expressed views on key aspects of our healthcare system. I want to ask you about a couple of them now that have proven controversial. One key area being vaccines. What effects do you think that Kennedy could have on vaccines in this country?
He could have a significant impact if he wants to. Through the CDC and FDA, he could alter the approval process and protocols for pushing a vaccine through from the research and development stage into getting it into the market where people can actually access it and use it at their doctor's offices, at the pharmacy, whatever they would choose to do. He can also, through those agencies, sort of change what information is put out about vaccinations.
He's also indicated plans to deprioritize infectious disease research and focus more on chronic disease. What do you see happening there?
Yeah, he wants to shift some of the funding and manpower at the National Institutes of Health, as you said, from research into infectious diseases to research into the underlying epidemiology of chronic disease.
Well, we'll certainly be watching this story and bring any updates as they develop. Nick Hutt, thank you for joining me today.
My pleasure. Thanks, Erika.